Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and try to make a better system for all of us. Let me point out that down below in the YouTube description box will be a link to the Healthcare Advocacy newsletter. You can subscribe for free, and it is the text for today's video. All of the backup material, references, links to newsletters and studies and the like, all of that's in the newsletter. Okay, let's get started. We're going to talk about some psychological issues today related to healthcare and some cybersecurity ones. But before we do, I want to talk about the Department of Defense abortion leave policy. I don't know if you remember this, but Senator Tommy Tuberville, who is a Republican from Alabama, drew a lot of bipartisan criticism last year for single-handedly stalling hundreds of military promotions, actually including friends of mine, in an unsuccessful bid to pressure the Pentagon into rescinding its travel policy. Tuberville ended the nearly 10-month standoff last December. The policy allows for service members to be reimbursed for travel if they or a family member have to go out of state for reproductive health care. Now, that includes abortions. It also includes things like IVF. The policy was used, get this, 12 times from June to December of last year. That's it. The Pentagon said last week Defense Secretary Lloyd Austin had instituted the policy after the Supreme Court overturned Roe v. Wade in 2022 to ensure that troops who were assigned to locations in the U.S. where abortions were banned or restricted had access to the reproductive health care they needed, including IVF, similar to what they have elsewhere throughout the world. Anyway, it's a matter of fairness. 12 times from June to December. Take a deep breath, and what's the lesson? You can govern or you can stonewall, but you can't do both. Okay, let's talk about mifepristone and the FDA that's on trial at the Supreme Court. The false lawsuit case that was brought against the FDA and mifepristone, which is one of a pair of abortion medications used in 63% of the abortions in the U.S., was argued this past week, I think Tuesday, at the Supreme Court. Now, I call it a false case because, in my opinion, none of the doctors, one of whom had only a master's degree in theology but claimed he was a doctor, and some others who were dentists, not physicians, brought the lawsuit. None of them were actually harmed. Also, there were studies upon which they based their, in quotes, evidence that were false. Those studies were retracted by the journals that they were published in because they lacked scientific rigor. You can view that as cherry-picking data, which they selected off the internet, to get the result they wanted to have. That's not how scientific studies work. The court seems to want to take the easy way out of this case and deny that those people who brought the case had standing, and thus they can just deny the whole thing. And mifepristone would again be legal. However, the problem that we're left with is that a judge anywhere in the future can take a similar case and rule that the FDA and their scientists and their doctors are unqualified to make decisions regarding the safety and efficacy of any medication. If they don't address that, then we will have lawsuits in the future calling into question every federal expert and agency. And that's kind of some of the most important things our government does. And how do we know it's going to be that way? Well, Supreme Court Justice Samuel Alito had a question at the hearing last Tuesday over the abortion pill mifepristone. If doctors who brought the case can't sue the FDA over a drug's labeling, who can and when? That was his question. So he's looking for a way to relegate the FDA to obscurity. It'll be horrible because anyone could then bring a lawsuit regarding a vaccine they don't like or any medication they don't like. And it just sends the government and their ability to regulate into the toilet. Okay, stay tuned. We're going to have to watch how this one goes. Let's talk about healthcare and cybersecurity. The U.S. Department of State last week on Wednesday offered a $10 million reward for information on the Black Cat ransomware gang who hit the United Health Group's technology unit, and snared insurance payments across America. The Alpha 5 Black Cat ransomware as a service group compromised computer networks of critical infrastructure sectors in the United States and worldwide, the department said in a statement announcing the reward. Okay, go to the newsletter, claim your reward. I have a link to where you can tell them if you have data. Let's talk about empathy deficit disorder. Before we get started, let me point out to you that I was pointed in this direction by one of our subscribers, and I thank him for that. Another subscriber, a friend of mine who's a psychologist, pointed out that empathy deficit disorder is actually a popular psychological term, that there are other terms regarding empathy. We're going to use empathy deficit disorder. I just love the way it sounds. Anyway, one of our subscribers posted a comment a week or so ago that described empathy deficit disorder. It was in response to my description of those people who favor medical eugenics. That is, if you're not rich enough or smart enough to manage your own health care, then death is a pretty suitable response, and you'll be making a better human gene pool. So I decided to do some research on it. People with empathy deficit disorder can't understand the pain of others. People with empathy deficit disorder tend to focus on their own needs and neglect other people's emotions, even those of close family and friends. They struggle to build and maintain emotional connections. They can be overly judgmental of others and underestimate what others are going through. They don't get the pain. They don't usually show appreciation or gratitude, and they struggle to understand people from a different cultural, political, or religious background. Empathy deficit disorder can be a symptom of bipolar disorder. It's also more common in antisocial and narcissistic personality types. That is actually a real psychological issue. And people who are on the autism spectrum, as well as those with psychopathic disorders, can show symptoms of empathy deficit disorder. It's also widespread in America today. A landmark study in 2010 found that Americans were less empathetic than their counterparts 30 years earlier. The authors of the study, and of course there's a link to it, examined the responses of about 14,000 students who had completed a questionnaire measuring different types of empathy. The results showed that the average level of empathetic concern, meaning people's feelings of sympathy for the misfortunes of others, declined by about 48% between 1979 and 2009, and it was a particularly steep decline between 2000 and 2009. Look, some people are bombarded with negative news all day long, and they retreat into focusing only on themselves. Others feel threatened by political upheaval that we have all around us, and they react to those threats with a lack of empathy towards others. It's a common political ploy, though, to make people feel in danger. So people do this on purpose, and then they offer to remove the danger if you vote for that particular candidate or party. Look, this is actually a page out of the authoritarian or fascist playbook. It worked really well in Europe in the 1930s. It works well. We've seen it work well in right-wing dictatorships in South America, and it is working in the United States. Look, you can teach people to have more concern for others. There have been studies at a number of educational levels, starting in middle school, going all the way through college, and they worked. They were able to demonstrate that people cared more for others when they went through the training. There have even been programs to teach doctors to relate better to the fears and concerns of patients, and those work. They take time and they take effort. But my concern is that as long as we're exposed to a 24-hour-a-day cycle of disinformation and doom, it is really hard to break through that cycle. What's the bottom line? I don't want people deciding the fate of our nation's healthcare system who have no empathy for others, because for them, medical eugenics is the answer. It's important that we all pick people who care about others. Then maybe we'll have a chance at defining and developing a healthcare system that really does work for all of us. That's what I've got for you. Down below, you can like, share, and subscribe. Send me your comments. You can also send comments to healthcareadvocacy1@gmail.com. If you have subjects you'd like reported on, let me know, and I'm happy to do it for you. That's it. Have a good day, and I'll talk to you next time.